right, so can you just introduce yourself and tell yourself a little bit, or tell us a little bit about yourself and your experience as an athletic trainer?
Okay, so my name is Neil Ehlers. I started athletic training. I went to undergrad at UConn, graduated there in 2014. From there, I went to Sacred Heart University for an internship. Worked with mainly the cross-country track and field team, helped out with some of the JV football team and things like that. From there, went to grad school at West Virginia University. Did that, graduated 2017, and then since then I've been working as an associate athletic trainer at Newberry College, a D2 university in South Carolina. I've been, for the majority of the time, I've been working football, baseball, but the first year I was also men's soccer. So a couple different sports, and the interesting thing for how we're employed for Newberry College is that we're actually employed through a large hospital system. So we're employed through Prisma Health hospital systems. And then from that, my department is in the Palmetto Health USC Orthopedic Center that then contracts us out to Newberry College. So we have 6 full-time staff athletic trainers, 5, we're going to get a 6th out there, and then 6 interns. And we cover all the Newberry sports, but we're employed through a hospital system.
Gotcha. Awesome. So that goes into my next question, how you got involved in a hospital setting, and obviously we're dealing with a pretty big situation right now. So what is your role currently being employed by a hospital, and what are you doing day to day during the current state of our world?
Okay. So, typically this time of year I'd be working baseball, and that's a lot of hours. So you're looking at, whether 65 to 75 hours a week of work. So with sports being shut down, the hospital transitioned us over to, first and foremost, is screening patients. It started out about 3 weeks ago where we were screening patients and visitors, but as things have been getting more and severe, we had to limit visitors. So there's only a select few cases where a visitor can come in, but for the most part, we're screening now patients and employees. So we'll set up at different entrances, whether it's the main entrance to the hospital or it's different crosswalks that employees will take, or actually set up outside of the emergency department to go through, and before the patients or employees come in, ask them a set of questions to make sure, do they have any flu-like symptoms, whether it be fever, shortness of breath, cough, chest pain, and then a couple other questions to kind of see their risk of exposure. From there, we'll take a temperature. And if it's a patient, obviously if they're going into the ER, the ED, we'll give a mask, and we'll just inform the nurses ahead of time that there's a potential illness that this patient has, so they can better prepare, not have them sit in the waiting room, not have them just wait at the registration desk. They can kind of move things and keep it a little more contained. And then obviously if it's an employee and there's a risk for illness, we would have to contact the hospital, and then they wouldn't be allowed to obviously come into work and potentially spread any sort of illness. So we've been doing that at a bunch of different locations. Like I said, it's a big hospital system, so there's a lot of different hospitals, a lot of different doctors' offices, and my supervisor, he realized that was going to be a need ahead of time. So kind of before everything started shutting down, he started reaching out and put this motion together to start being able to have this system where we can start screening people as soon as possible and make sure that things are kind of moving as smooth, even though everything's kind of chaotic. And our protocols that we're using screening are fluid. They're changing, sometimes every 15 minutes, more so in the beginning. And now that there's more restrictions from the state, moving forward, it's stabilized, but he got ahead of it and started putting us in those different situations, which is very appreciative for people like me, where if your school starts to shut down, yes, I'm fortunate to be at a college and can do rehabs and different things, but if you're at a high school and a secondary athletic trainer in a high school, there's not as much that is going on.
Mhm.
So this gives them 40 hours to get work done and to be able to stay employed, where, I mean, if you see how many people are getting furloughed or laid off, it's very fortunate that we're able to move into that role. And I think it's a very fitting role for athletic trainers, because we can take histories. We are customer service 24/7, talking to patients and parents and coaches, and we know how to keep calm in different situations, and also have good critical thinking.
Mm.
So I think it fit very well for us as athletic trainers to move into that role, and then kind of go that way.
Mm.
There's some other things that I'm doing that is along this. Do you want me to get into that with they had kind of asked us to start going into some drive-through testing?
Sure. Yeah, I was going to ask actually what it's been like to be on the front lines and how it may have changed from being just at the hospital, and ask if you've done any of the drive-through testing. So absolutely, go for it.
Okay. So one of the things that we were able to get into was drive-through testing. So we're still getting our 40 hours, which, like for me, I said, it's a combination of screening. Usually it's about half screening, and then the rest of getting paperwork and checking with athletes and doing rehabs. But then in addition to that, I mean, since I was already planning on, working 65 or 70, whatever hours, they said, do you want to do additional work and help out with the drive-through? So for the drive-through, they started setting that up. And what we can do as athletic trainers probably depends on the state, or what the hospital wants you to do. I think maybe some states you could be actually swabbing, but for us, we're not doing that. We're having the RNs swab. But what we will do is the quote unquote clean nurse side, because the swabbing nurses are going to be considered dirty. So how they're passing the sample back, it has to go through a certain process that the clean nurse helps with, or I guess you could say the clean athlete trainer, because a lot of us are doing that now, and goes from that, and then goes into a fridge where then the lab technicians come and take it. So it's really something that it's all kind of procedural, and we go through different trainings to get a routine of how to do emergency procedures or different things. So it's not a whole lot too difficult to learn, especially when you're used to doing that, and just kind of following rules and following directions a certain way. So for me, what I've mostly been doing is that clean athlete trainer, clean nurse, clean person role, where you'll hand them an Oxivir wipe, and the swabbing nurse is going to clean that whole bag. They're going to clean it after they put the vial in the bag, clean it, seal it up, and then you hold another bag open so that nothing can kind of touch it. They'll drop that bag with the vial in there. You seal it up, put it away, put it in the fridge, and then you go through a process of, taking your gloves off, sterilizing your hands, sterilizing their hands, and then everyone gloves back on, and you kind of repeat. So just kind of like a little bit of a procedure of going through that, and making sure that the samples are going to the right place, that it's the right person being swabbed and all that. Because when you have a drive-through, I mean, if you're talking about like a drive-through at a McDonald's or something, if you accidentally get the wrong order and you got chicken nuggets versus French fries, it's not a big deal. But if you have the wrong person swabbed for the COVID-19 test, it's a much bigger deal. So just to, double, triple, quadruple check that person is who they are, look at the license, ask them some questions, make sure that sample goes where it's supposed to go. And then they get followed up with, obviously. The other thing we've been helping with is kind of patient registration. So going through and getting kind of a brief history, which is obviously something that we're familiar with: a name, birth date, how they got to the testing site if they have an appointment, maybe some symptoms, and then like vehicle identifiers. So whether it's a black Ford SUV, so that they're in line and we can again line up that sample, that test with that person. And then working with different nurses and people in registration to move that process along. So kind of we'll do everything but swabbing, at least here, for Prisma Health. So it's helped the nurses out a lot where they're still having to do shifts in the hospital. And if we can come and take some of that load where they don't have to do the cleaning and they don't have to do the registration, then it helps them out a whole lot, to kind of keep this process moving and to keep it so that they're not working, 7 12-hour days, because right now there's a huge stress on the healthcare system.
Absolutely. That's really interesting to hear that whole process of how it's being handled. How many people have you been seeing in a day? Is it really as I don't know what, like, widespread as the media is saying? Like, are you seeing hundreds to thousands of people?
So for us in South Carolina, and specifically at Prisma Health, we'll see anywhere from 70 patients to 150 patients a day of swabbing. And that's just our one location. We also have a location that's specifically swabbing employees. And then they have, where I'm located is in the Midlands of South Carolina. So we're kind of taking care of that Columbia, the middle part of the state. And then the other part of our hospital is taking the upstate. So they're probably getting similar numbers. And there's a couple other testing sites. I think the last time that I checked, DHEC, which is our Department of Environmental Health, they are putting out numbers of tests run, and then positives. And I believe we were somewhere around, let's say 17 or 18,000 tests. And that was a combination between being the sample tested at DHEC or the sample tested by an outside lab. Most of them, I think, are being sent to Quest. Some of them are being in-house at the hospital. But they had about 17 or 18,000 tests done since we started. And then and again, these are probably numbers from Friday, so it's changed, but maybe about 1,700, maybe about 1,700, somewhere around there, positives. So, obviously it's not where we want. I think in just Columbia alone, there's probably 100,000 people. But I mean, you're testing the people that come in. Most of them are either concerned for an exposure, they know someone who's tested positive and they've been around them, or they're experiencing symptoms. So I think it's good in that regard too, because if your test is getting sent out to Quest, it could be 7 to 10 days for your results. And typically we test people who are well, if they're emergent, we're going to send them to the ER because, like I said, the test will take 7 to 10 days. So if we notice that they're in distress, and typically it's going to be a shortness of breath, that's one of your biggest symptoms, and your highest risk factor is going to be respiration and breathing and all that. So if they're having shortness of breath just sitting there, or they're like, yeah, when I'm sitting at the couch and I get up to go to the kitchen and I have shortness of breath, well, that's more of a significant factor, and we'll send them to the ER because they can get that test back a little bit sooner. And then if in that time frame something is more emergent, they can obviously treat the symptoms and help them breathe and get a little bit more oxygen to their body. So most of the people we see through the drive-through are, I wouldn't say they're all healthy, but they're not in an emergent situation. So those emergent ones are going to go to the ED where they can better take care of it and monitor them. Where for us, if you get a test, you're quarantined until your test results come back. So that's about 7 to 10 days. If you get no results back, if you don't hear anything, you're going to keep monitoring and keep quarantine until 14 days. And then if your test comes back positive, it's 14 days. So if something emergent happens in that time frame, they need to also realize they need to go to the ER so that they can, be safe and not just sit there waiting for a test result.
Right. That's very interesting and I don't know, almost how are you dealing with obviously being on the front line, like how are you dealing with it, like emotionally, and like obviously as athletic trainers, like you said, we're trained to stay calm and be able to handle stressful situations, but something like this where it's global and this like thing that we can't see, how are you kind of coping with being on the front line of it?
Well, I think initially, obviously, with I think one night we got a text and said, "Hey, we're going to start screening people at the hospitals, taking the temperatures, during this COVID pandemic." And my initial reaction was, "What the heck? Am I going to be safe? Are my roommates going to get sick? Like, what's going to happen? Do I tell my parents?" And then after, sleeping on it, the next morning I was like, well, as an athletic trainer and starting this in National Athletic Training Month, I was like, maybe at least, one, I'll keep my job. Try and make yourself as useful as possible. I think, especially if you volunteer first, you're going to be obviously always regarded as someone who's a more valuable employee. But then also to put ourselves out there as a profession for not just my hospital system, but the community, and then, for the whole social media world. I mean, it's National Athletic Training Month, and I think 2 years ago we had a slogan for National Athletic Training Month that was like, ATs are healthcare, and this year was, action. And I mean, those two fit so perfectly for what we're doing, is that we're not just there on the sidelines. And as athletic trainers, we all know that, but the community doesn't. There are so many different things that we can do and we can benefit our community with. And I think this was a prime example to show, how people can step up and how our profession can help the community. So that kind of helped me get over the whole initial kind of worries of what's going on. Once I got there and saw what we're doing, saw how we keep ourselves safe, how we keep the people we work with safe, and how we keep the people who are coming to get tested safe, it kind of also made me feel a little bit better about that. Because like I mentioned before, with emergency procedures, I mean, if you know nothing about spine boarding or using an AED and you have to do it, you're probably going to freak out. But when you test and you prepare and you understand why and how, you feel comfortable, you feel confident, and then when there is a situation, you can react accordingly. I mean, we actually just had one of our coworkers, before this all kind of fell apart, she had two of her baseball athletes collide in the outfield, and one of their hearts stopped. And Second Nature ran out there, AED, took vitals, put the AED on, and revived this athlete. And, something everyone's like, oh, well, can I do that? I've trained to do that, and just kind of becomes second nature. And she did something amazing and saved this athlete's life. Now, obviously, keeping yourself uncontaminated is not as substantial of a thing, but it's similar. We're now, when I'm going through cleaning or when I come home, my protocol, the kind of like personal protocol of taking my shoes off in the garage, or taking my stuff off, putting it right in the washing machine, and then taking a shower before I really touch anything. That's now kind of becoming second nature, and you don't think about it. So you're not as nervous of, am I going to contaminate this or not? You just kind of do it and know, this is how I'm going to be safe. This is how I'm going to keep the people I'm around safe and people I work with safe. So
awesome. Yeah. Kind of finishing up, do you have any advice for like the public as we deal with this, and as we're kind of, this whole idea of social distancing and helping to flatten the curve? Like, do you have any, what's your opinion on that, and do you have any advice moving forward that you really, as someone dealing with it, as a healthcare provider, want people to know?
Well, I think the biggest thing is, especially in any sort of crisis situation, is to really remain calm and kind of think through things rationally. There's a whole lot of stress going on, whether it's directly because of people that are sick, or you're sick, or your family's sick, or whether it's because of this virus, you're either you're not working as often. I know unemployment is hugely backed up. So with all those stresses, they're just to try and remain calm. I know it's easier said than done. There's a lot of kind of things you can look up, whether it's, different relaxation techniques or breathing techniques, or just trying to do something that you like, make the best of being home and being with your family if you have some, and being able to do things outside in your area, obviously away from people. But just to try and make the best of it and be as calm and relaxed as possible, because that helps everybody out. The other thing is I would, unless you have to go to work because you're an essential employee, or you have to go to the grocery store or whatnot, I would stay away from people and try and social distance. There's a ton of things you can do. There's different platforms to video chat. You can even stand across the street and talk to your neighbors. There's a ton of things you can do to socially distance, especially while this is spreading so much. I think that's one thing that you can see in places with higher population densities. It's obviously spreading quicker because there's not as many places to go or areas to get out. And that's kind of a big factor for it. So, you see all the nurses and healthcare workers holding up the signs of, we stay here for you, so please stay home for us. I think that's a great point just to make, is that, it's not just a me situation. This is an all of us situation, and we all need to do our part, whether that's being a healthcare worker, being working in a grocery store, working in any of these essential places, or if we're not doing any of that and we're staying home, to stay home and to wash our hands, good hygiene, and try and make sure that we can do our part to contain it. So that's really all I have to say is that this is an all of us situation. This is, we're all in it together. It can affect anybody. So
Definitely. Thank you. 2 more questions. What can other athletic trainers or AT students do to be involved with dealing with this? Do you know of like volunteer opportunities for people like myself to get involved in helping, or do you think it's more of like in your case where you were already employed by a hospital and your role just kind of changed in the time?
I think it probably depends on your area, what's going on in your state, in your town, in the cities near you. I know, like right now, there's a huge healthcare shortage of people in some of those majorly affected areas, New York City being one of them. I've heard of nurses going over there from other states or other places to help out. So I would just reach out. I don't know if there is a kind of national or state or whatever local kind of resource to call and say, hey, we want to help. We have this background. How can I help you guys, or where can you put me to volunteer? But short of that, I would just call your local hospital. I'd call, local clinics that might be dealing with this and just saying, hey, I'm a healthcare professional. This is what I can do. this is the things that are in my scope of practice. Is that useful to you? And at the very least, if it's not at the time, unfortunately, healthcare workers are going to be getting sick. They get sick because they're on the front lines, and it's inevitable. So as that kind of cycles through, there's probably going to be a need for other people to step up. So just constantly staying in communication with people like that, with hospitals and different places that are probably going to be short-staffed at some point. And just trying to stay connected that way. If you know someone who's doing it, you can reach out to that person too. As of right now, for my hospital situation, I think there are a lot of volunteers already set up in place because obviously our state has shut down non-essential surgeries and things like that. So there's a lot of surgical techs and people who would normally do orthopedic surgeries that are non-emergent and other things, different procedures that are kind of available. But I mean, I would just reach out and see what you can do. It never hurts to ask.
Right. Awesome. And then last but not least, for our athletes who are kind of on hiatus now from what would be, their season for spring sports, what is your main advice to our athletes in staying healthy and dealing with this and just kind of in moving forward?
I think the biggest thing, and I mean, you see it with injuries and other things all the time, is for athletes, and most of them, especially if they make it to the collegiate level or not, whether they're at high school. I mean, athletics is such a huge part of their life, right? So they have that strong athletic identity, and to this point of their life, it's probably what they view themselves as a soccer player, as a football player, as a pitcher. And just for them to realize that everything they've done so far, just because they can't continue to play and continue to compete, everything they've done so far isn't just for naught. It's all there. All of their relationships they've made with different players, different coaches, athletic trainers. I mean, a huge social support system that's in place. And they spend so much time together that they've formed these relationships that really surpass any sort of stoppage of play, and they'll be there during this crisis. They'll be there after this crisis. So just to remember that the things that they've done to this point are all still there. They still have those relationships. They still have those outlets. And along those lines, for you had mentioned with just being healthy, is that all of their athletic trainers are still there for them. I mean, I know most of us get texts when we're like trying to go to bed or ready to do something else, and we'll respond, and we're always there for them as another support system to reach out, whether they're feeling, down or frustrated with the situation, or if, hey, they have a basketball hoop at their house and they're playing pickup basketball and now they've sprained an ankle. Well, reach out so we can help you, because that's what we're here for. And if you are coming back to play, we need to make sure that you're good to go for when it starts, so you can hit the ground running. So that'd be what I'd have to say to them, is just don't lose sight of kind of all the connections and everything good that's happened with sports, just because right now you can't compete or you can't play.
Definitely. Awesome. All right, that's all I have. Thank you so much for taking the time to meet with us and get this information out there. And thank you for what you're doing, and good luck, and hopefully life will get back to normal soon.
Yeah, I hope so. And thank you.